Do you know anybody that's had a life-changing event? Well, I believe that we've all had that experience. But there's also part of us that says, oh, that'll never happen to me, until that does happen to that person. But have you ever been out on the freeway, driving down your local highway or the freeway and see an accident? And sometimes it's just a minor accident, 2 cars or 3 cars to the side. But then there's other times where they have a whole section blocked off, there's ambulance there, maybe even a helicopter that's come to rescue the person. Have you ever wondered if that accident, when somebody has to be transported to a hospital, how severe that accident may have been? Something we don't really think about, but if you think about this for a moment, I say a moment in time can change your life forever. I always say if you were leaving your house and something happened when you were out, and if you thought back to it and said, man, if I only left a minute earlier or a minute later, what happened to me in that moment wouldn't have ever happened. How many people do you think that's had an accident that if they had simply left their house a minute earlier or a minute later, it wouldn't have happened? But what if they turned left instead of turning right? Would have a different outcome. I always say, even when it comes down to life, it's only in the moment that we have that we're given. So I always say the moment in time is the moment in time. It's what you do with the moment you have. For the most part, we take a moment for granted. But I always say, if you knew the next moment was your last moment, what would you do with the moment before? We don't think about it, but everything in life is based on where you are in the moment you're at. So when it comes to health insurance or the cost, well, it really comes down to that. If you ever really wanted to know what it's like, simply go to an emergency room and spend a little time in an emergency room in a hospital. When we actually use our healthcare system, isn't just because we're not feeling well. If you're not feeling well and you want to go see your doctor, great. I'll tell you exactly what your doctor's going to do. He's going to take your vitals, write your prescription, tell you to go home. When we really truly use a healthcare system is when you have a life-changing event. Something puts you in that emergency room, and 1 or 2 things are going to happen. Either you're going to get treated and released and get a bill. I'll guarantee you that bill will be more than $5,000. And if you're a minute in the hospital, I'll tell you that bill will be thousands and thousands of dollars. Which is it? The thing is, what's your financial responsibility when you end up in the hospital? Or you have children that play a sport. I have 2 grandsons play baseball. One of my grandsons, the older one, 16 years old at the time, played football. Got a concussion. Got hit really hard. The thing is he's still playing it. Now, he's chosen to stay with baseball. But the thing is, if you have a child that's playing a sport, when something happens, what's the cost? What's your health plan? I've found that most people, in my 23 years of selling health insurance, most people have no idea what they have for health insurance. I'll ask them, I don't know. So I'll ask them, what's your copayment? $35, $50. Well, it gives me a pretty good indication what they have. The thing is, when you do have a life-changing event, whether it's a family member or you yourself have a life-changing experience, what are you going to do in life? What's the financial cost? I have a solution. I develop comprehensive health plans. If you think health insurance is enough to be able to protect you financially, well, you better think again. Because think about the premiums you pay for your health insurance. When you actually use your health insurance, you actually pay again. There's something wrong with that picture. But where do you think each and every year, if you have your own health insurance, and if you're getting any government assistance through the exchange and getting a subsidy, you're not paying the full cost of your health insurance. If you're working for an employer that provides health insurance and you're on their health plan, guess how long your health insurance is good for when you're working for your employer? As long as you're working for your employer. What if something was to happen, you can't work? It's obvious what's going to happen first. If you're not working, where's your income come from? Is your employer going to continue to pay you? Do you have savings? Do you have some way to be able to support yourself if you're not working? But what if you're in the hospital? What if you're in ICU? Somewhere where it's not. I always say the thing is, people, when they worry the most, is when they're in the hospital and they say, how much is this going to cost us? Well, the thing is, what is it going to cost you? The thing we don't know is we don't know. But it's understanding, how do you prepare yourself if you do have a life-changing event? Well, that's where I come in. I have a solution to be able to help people get through this, to be able to understand how to protect yourself, just as you do through your employer. Hopefully you're putting money away for your retirement. But I always say, even with a retirement account, your 401k that you're contributing money to, particularly right now, is that money that you're putting in there that you're going to retire someday with, is it guaranteed? No. Is healthcare, is being treated guaranteed? No, there's nothing guaranteed in life. But if you understand what your risks are and what you need to do, is there. So when it comes to whether you have an illness or an accident, there is a solution. I always say, even if you go through a diagnosis, with cancer, for example, just getting the news, and we all know someone has had cancer in their life, getting the news is a what? Very emotional. That's part one. What's the second part? The physical aspect, what the treatment's going to be. Probably the most important thing is what's the financial cost. Do you have the financial means to get the care and treatment you want? Now, we know what we have as far as our healthcare system today, but do you know where our healthcare system is going to be 5 years from now? With our current administration, whether you agree with it or not, what impact is that going to have on our healthcare? What impact is that going to have on you and your family? If you're paying the full cost of your health insurance, you know what the cost is. The thing with health insurance, it keeps going up every year. So what do you have to do? You have to take on greater responsibility for your part as far as what you're going to pay when it comes to using it. So think about that person that's on that bronze plan that has a $5,800 as of 2025, a $5,800 deductible. Max out of pocket, $8,850. What's that going to do for that person when they get that bill if they had a life-changing event? But that's this year. What's it going to be like next year? Again, the ACA is on the verge of shutting down. Don't know what's going to happen in 2026. We are going to, at some point, going to go to a universal healthcare system. It's where you're going to be as far as within that system. So my responsibility is to help people navigate through this. And through my podcast and the guests I'm bringing on, is to be able to bring in those experts that people are actually going to see the change that are going to take place in our healthcare. Because nobody is addressing that. But every year, our cost of healthcare continues to go up. At some point, when is it going to be where you can't afford your health insurance? Then what? Because you can either protect yourself today or pay the price later. Nobody knows, but we know what we know in the present moment. So again, my responsibility is to be able to bring up the information and the facts so that you can make an informed decision on what works best for you, whether it's you and your family or you as an individual. How are you using the healthcare system today? And where do you see our healthcare system in the future? Again, it's all going to be spelled out through my podcast. So I hope you'll give me a thumbs up and subscribe, because it's folks like yourself that I want to be able to get the information to. Do I have all the answers? No, but I will get the answer. To me, it's helping you to make an informed decision. That's what I'm here for.